Welcome to the Healthcare Motivation Channel, where we share insightful perspectives for healthcare professionals. If you find value here, please click like and subscribe and share this video with someone you know who could use an encouraging word today. Today's topic is about suicide prevention and awareness for healthcare workers. What is suicide prevention and awareness? Suicide prevention involves efforts to identify, support, and reduce factors that increase suicide risk. Awareness is described as understanding the signs, risk factors, and resources available to intervene early. For healthcare workers, this means recognizing these elements, not just in their patients, but in themselves and their colleagues, to foster a safer, supportive workplace environment. Why is it important for healthcare workers to understand suicide prevention and awareness for themselves? The reason is because healthcare workers face unique challenges. For example, healthcare workers often face high stress, long hours, exposure to trauma, death, and dying. They also face stigma in seeking behavioral health support, and they face higher suicide risk rates compared to other populations. By understanding suicide prevention and awareness, healthcare workers can better support themselves and their peers, breaking stigma and creating intervention opportunities to save lives. Let's take a look at the data because it is humbling. According to research, approximately 300 to 400 physicians die each year due to suicide. For example, a physician working excessive hours with untreated depression misses warning signs leading to a tragic outcome. Another study reported that female healthcare workers have higher suicide rates than the general population. For example, a nurse struggling with work-life balance and burnout may be vulnerable without support. Approximately 62% of nurses reported increased workload during the COVID-19 pandemic, contributing to mental health decline. For example, a trauma ICU nurse experiences overwhelming stress from patient deaths, leading to isolation. Another study revealed that approximately 75% of healthcare workers feel overwhelmed with inadequate emotional support available. For example, a paramedic witnessing trauma lacks access to peer support programs and spirals into despair. Lastly, there was a study which related to healthcare professionals who work in psychiatric care. The study revealed that access to lethal means and job-related stress correlates with suicidal thoughts among psychiatric ward staff. An example of this could be a psychiatric nurse who is experiencing feelings of burnout between work life and personal life. The nurse, who did not seek medical help out of shame, took matters into her own hands and accessed the clinical department's medication drawer to self-administer the lethal dose of medication. There are several leading experts who have contributed to the area of suicide prevention and awareness. For example, Thomas E. Joyner Jr. developed the interpersonal psychological theory of suicide, focusing on burdensomeness and belongingness. His framework helps assess and reduce risk factors effectively. Marcia M. Linehan created dialectical behavior therapy, DBT, proven effective in reducing suicidal behaviors through emotion regulation and distress tolerance. Barbara Stanley and Gregory Brown developed cognitive behavioral therapy for suicide prevention, CBT-SP, focusing on modifying harmful thought patterns. Peer support models, like the Prevail program, show that shared experience and peer connection boost hope and decrease risk. These evidence-based frameworks, backed by peer-reviewed research, provide proven pathways to intervention, helping healthcare workers and organizations implement strategies that save lives. Now, let's talk about some high-impact strategies to consider. 1. Use structured peer support programs. Encourage or join organized peer recovery and support groups within your healthcare organization. For example, a hospital could have a weekly peer support group for nursing staff to share stress management techniques and emotional support after difficult shifts. 2. Participate in routine suicide risk screenings and mental health check-ins. On shift start, healthcare workers can complete brief mental health check-ins or screenings. For instance, implementing a digital questionnaire that asks about mood and suicidal thoughts can help identify those needing support early. 3. Encourage open, non-judgmental communication. Foster team environments where talking about mental health and suicide is normal and stigma-free. Team leaders can start meetings by openly acknowledging mental health challenges and inviting sharing without judgment. 4. Ensure confidential access to behavioral health care and resources. Make sure staff know about confidential behavioral health services, employee assistance programs, EAP, and quick referral pathways to mental health professionals. For example, distributing easy access cards with confidential contact info and ensuring supervisors respect privacy. 5. Advocate for organizational change. Promote policies supporting reasonable workloads, adequate staffing, and budget allocation for mental health resources. Healthcare workers or committees can present evidence to leadership emphasizing the link between workload and burnout risk. Lastly, please reach out to your primary care provider, licensed mental health professional, or call the Suicide Prevention Hotline if you or someone you know has a mental health or substance misuse concern. If you are in the United States and danger for self-harm seems imminent, please call 911. Also, you can call 988 for the free and confidential suicide prevention hotline to talk with a caring professional. The suicide prevention hotline number is open 24/7 and available by phone, text message, or chat. 988 connects callers with a crisis support team, and they provide community resources. You can also go to the Substance Abuse and Mental Health Services Administration website at samhsa.gov or go to 988lifeline.org. You can also reach out to your local hospital or health department for resources and support. If you are outside of the United States, make a list of mental health services in your area and store the information for easy access, just in case you or someone you know experiences a need for support services. Please remember that you are important, you are loved, and you are not alone. Thank you for tuning into the Healthcare Motivation channel. If you like this video, please click like and subscribe. It is our goal to support and provide an encouraging word to healthcare workers and caregivers as they care for others. Stay focused, stay connected, and we'll see you in the next video.